Today, I want to discuss something that's very important for anyone going through IVF. The difference between transferring one embryo versus transferring two or more embryos at a time. You'll be surprised how often I hear patients say, "Doctor, can you put back two or even three embryos? I just want to get pregnant quickly." And you know what? That's exactly what many IVF clinics are doing, routinely transferring two, three, even four embryos in one go. But while that may sound like a shortcut to success, it's actually a dangerous practice that can cause more harm than good. Yes, transferring more embryos can increase your chance of pregnancy in that cycle, but that comes at a huge cost, the risk of multiple pregnancies. Now, many patients get excited at the thought of twins. I understand it seems like a bonus. Two babies for the price of one, right? They imagine dressing their twins in identical clothes, posting cute photos, and becoming the center of attention. But the reality of a twin pregnancy is very different. Twin pregnancies are high risk pregnancies. They increase the chances of miscarriages, where you lose the entire pregnancy, preterm labor leading to babies born too early, NICU admissions, where your newborns might spend weeks or even months in intensive care, and sadly, sometimes even permanent handicaps like cerebral palsy or vision problems like retinopathy of prematurity. So while you may get pregnant, you're exposing yourself and your future baby to serious health risks. So why do clinics do it then? Simple, it boosts their short-term success rates. The clinic can proudly say, "Look, our pregnancy rates are high." But what they don't talk about are the long-term outcomes. How many of those pregnancies actually resulted in healthy, full-term babies? And that's the key difference. As a patient, you don't just want a positive pregnancy test, you want a healthy baby in your arms. That's the real goal of IVF. And here's something else most patients don't realize. If you put back three embryos and the cycle fails, you've lost all your embryos. No backups, no frozen embryos for future transfers. You have to go through the entire IVF cycle again, which means more injections, more stress, and more money. Now, contrast this with elective single embryo transfer or ESET. When you transfer one high quality blastocyst and freeze the rest, even if that first cycle doesn't work, you still have frozen embryos available for future tries. And frozen embryo transfers are less expensive, less invasive, and equally effective. So your cumulative success rate, the chance of eventually having a baby after using all your embryos, is actually higher when you transfer one embryo at a time. Now, let me tell you another truth IVF clinics don't always share. The reason they transfer multiple embryos, especially on day 3, is because they don't trust their embryology lab to grow embryos to day 5 blastocysts. So they put back as many as they can, hoping that at least one will implant. That's not science. That's guesswork. A good lab will confidently grow embryos to day 5 and select the best one, giving you a much safer and more efficient path to success. So here's my sincere advice. If a clinic insists on transferring 2 or more embryos as their standard practice, please treat that as a red flag. That doctor may be focused on their clinic's pregnancy stats, not your well-being. Look for a clinic that follows global best practices, one that prioritizes elective single blastocyst transfer and your long-term health and outcome. Remember, IVF is not a race. It's about doing what's safe, scientific, and sensible. Because at the end of the day, your goal isn't just a pregnancy, it's a healthy baby. If you have questions about your IVF journey, drop them in the comments. I'd love to help. Thank you for watching and take care.